on, y'all. Excuse me. Ooh. Give me a second. I just got a flashback. Nursing school flashback. Woo! Because every single time an instructor said, today we're learning a new respiratory disorder, my anxiety immediately clocking in for work. COPD, asthma, ARDS, pulmonary edema. What's another one? Pneumonia, pulmonary embolism. Linda. I told you. I keep telling y'all. These are not 6 different things. They are one pattern wearing 6 different outfits. Woo. And that's exactly why so many nursing students feel overwhelmed. And guess what? I was that one, okay? Because you're trying to memorize diseases instead of recognizing patterns. So today, I'm going to show you the very first core clinical pattern I teach in A&I. It's called the oxygenation pattern. And if respiratory have your head spinning, this video is for you, like it's doing for me right now. So let me tell y'all, when I was in nursing school, I honestly thought everybody else understood respiratory except for me. Everybody seemed so confident. Meanwhile, I had to color code notes, do my flashcards, plethora of study guides, looking at various videos. And what those were was just more resources than common sense. And I was still confused because every chapter felt like a completely different topic. Then one day I realized something. The NCLEX wasn't testing whether I could memorize diseases. It was testing whether I understood what oxygen was doing. Game changer. Because once I saw the pattern, everything started connecting, okay? So now, when I look at a respiratory question, I don't ask, what disease is this? So what I do, I ask, what's stopping oxygen from getting where it needs to go? That's the question. Every single time. Because oxygen has one job. Get to the tissues, right? And if it's not getting there, I need to know why. That's clinical thinking. That's clinical judgment. That is nursing. Let me put this away, y'all, because that's anxiety over there. All right, so I'm going to teach you the 3 oxygen barriers, okay? So here's how I teach it. There are 3 major barriers. 3 reasons why oxygen isn't getting where it needs to go. It's not 20. It's not 50. 3. Did y'all hear me? I said 3. Okay, so barrier number 1, air can't get in. This is your asthma, your COPD exacerbation, your airway obstruction. The body is trying to move air, but something is standing in its way. What could that be? Or what do we see? So some signs and symptoms are like wheezing, shortness of breath, the accessory muscle use, retractions is another one. And most importantly, the patient looked like they were working hard just to breathe. But you ask, why? Because air can't get in. That's the problem. Linda and Larry, I forgot to include you in the beginning. If air can't get in, oxygen can't get in either. Okay, y'all, okay. Stay with me, okay. Barrier number 2, oxygen cannot cross. Okay, so let's talk about pneumonia. What's another one? Pulmonary edema, ARDS. All right, different chapter, different diagnosis, a different barrier. Here, air is getting into the lungs, but the problem is oxygen can't cross. So you guys know that alveoli are full of fluid, inflammation, junk. Now, what are we seeing? Low oxygen saturation, crackles, increased oxygen needs, tachypnea. That's a key word. The body is screaming, I've got oxygen at the door, but I can't get inside. Again, different diseases, the same framework. All right, barrier number 3, oxygen can't reach the tissues. Now let's talk perfusion. Pulmonary embolism, massive blood loss, severe shock. The lungs actually might be working, but the oxygen the oxygen may be there, but circulation is the issue. So the delivery system is broken. All right, Leroy, did you hear me? Yes, I'm calling you out specifically. I don't care how much oxygen is sitting in the lungs if it can't get delivered. So think of it like Amazon loading the truck and never leaving the warehouse. You get no delivery, no oxygen, no happy tissues. Excuse me. So this is one of the reasons why nursing students miss questions. So now let's talk about why we get those respiratory questions wrong. Because y'all, this is important. Most of them read pneumonia and immediately start flipping through every pneumonia fact they've ever memorized. I don't. What I do, I ask, what is the barrier? Most importantly, basically, what's the problem? What assessment findings would support this particular problem? Do y'all see the difference? So I'm not chasing diagnosis. I'm looking for evidence. And guess what? That's what nurses do. All right, so let me think of an example. Let's take pneumonia. All right, the patient has pneumonia. Most students think, oh, this is the pneumonia chapter. Okay, great. I got a book full of knowledge. I think oxygen can't cross. So now I'm looking for findings that support impaired gas exchange. What are those? Low oxygen saturations, crackles, increased respiratory rate, shortness of breath, of course. Everything starts making sense because the pattern told me what to expect. The disease didn't. The pattern did. Did y'all catch that? If not, just rewind it a couple of seconds, okay? Because I really want y'all to get this, okay? And here's the part where no one tells you. And this right here is why I say something that makes people uncomfortable. Most nursing students do not need another study resource. I know. Tish, yes, why are you telling me this? So don't be throwing y'all Sanders book at me, okay? But hear me out, okay? Most students aren't struggling because they don't have enough information. Most students are drowning in information. What they're missing is organization, a framework, as well as a way to connect what they're learning. Because once your brain has a place to put the information, everything else starts clicking. You got that, right? That's exactly why I created Applied Nursing Intelligence, because I got tired of watching students, as well as me, believe they weren't smart enough. That wasn't the problem. The problem was no one showed them the patterns. No one showed them how to think through what was actually happening. No one taught them how to recognize clinical clues. And once you start recognizing patterns, your confidence changes. Your decision-making changes. Your clinical judgment changes. Are you guys seeing that? Everything changes. I really want y'all to dial in, okay? So please hear me out. Use these principles. So now, if you're sitting there thinking, Tish, this is the first time respiratory has actually made sense. Good. Because that's exactly why I created the A&I intensive starting July 18th. I'm opening up a small beta cohort where I'll be working directly with nursing students for 6 weeks. And let me be clear. This ain't tutoring, okay? This is not me sitting on Zoom reading PowerPoint slides to you. And this is definitely isn't another study resource to collect dust on your laptop. We're going to focus on what actually moves the needle, which is pattern recognition, clinical thinking, clinical judgment, decision making, the stuff that helps nursing finally clicks. The same stuff I wish somebody had taught me when I was deep down struggling, when I was overthinking those particular questions, when I was changing the right answers to the wrong one, when I was convinced everybody else understood nursing except me. So hear me out, yeah. If I can save you 6 months of frustration, why wouldn't I? So if you're interested, check out the link below. I am intentionally keeping this first cohort small, just 10 students. We start July 18th. And I love to help you build the confidence that comes from actually understanding what you're seeing. All right? Thank you guys for being with me. So the next time you see a respiratory question, I want you to stop asking, what disease is this? Instead, ask, what's stopping oxygen from getting to where it needs to go? Air can't get in, oxygen can't cross, or oxygen can't be delivered. Those are your 3 barriers. One framework. And suddenly, all of those 6 different chapters become one pattern. All right? Then I tell you, if this helped nursing finally clicks, make sure you subscribe, because we're going to keep breaking down the core clinical patterns every nursing student should know. And if you know a nursing student who's drowning in flashcards right now, y'all go ahead and send them this video. They might be one pattern away from finally getting it. Remember, y'all need to stop memorizing and start recognizing. Okay? And I'll see you on the next one. Love y'all. Tish.